Hi everyone, my name is Armando Mendoza. This is my introduction of critical theories on HIV. And components of the components of theory, theoretical, conceptual, comprehensive framework. The key theory of social work framework that I will discuss will be cognitive behavioral theory, which relates to understanding the mindset on HIV itself and HIV prevention and the demographic of the Latinx community. The key problem that the research will be addressing is taking a more in-depth look into the community and disparities they might have to have a clear understanding of the Latinx community's view of HIV and HIV prevention. And in the state of Alabama, such disparities will include looking into how the community views HIV testing, such as whether the Latinx community testing for HIV and other STIs regularly, and if not, then why are they not testing more frequently? The research will look into address and will also look to address other key issues that show that could prevent the Latinx community from getting resources and help to address their sexual health on HIV and other STIs, such as looking to see if it's due to lack of medical care, lack of transportation, lack of proper medical translators or medical doctors that speak their language. Additional um, components to this is past research has shown some key concerns uh, as often the Latinx community fears the stigma that HIV has due to the fear of family being disappointed in them, as it can have that stigma that HIV is for those in the LGBT community only. Also, the lack of resources to medical care by not having medical insurance or not knowing where to get HIV tested for free around their areas, and also the lack of transportation, a lack of language barriers, and also the fear of revealing their immigration status to medical clinics that offer HIV testing. Cognitive behavioral theory will look into these key concerns as it will address the anxiety and mental thinking of addressing those fears, as mentioned before, the Latinx community has the when it comes to HIV testing and prevention side to it. Integrations of critical theories. Cognitive behavioral therapy within the social work practice correlates to not only addressing the key issues, but also looking to educate the clients that we serve who are looking to get HIV tested, such as addressing the anxieties that come with HIV testing by helping to educate our clients to address misconceptions of HIV by educating the community about HIV and its treatments and prevention medications such as PrEP, PEP, and using cognitive behavioral therapy by using relaxation exercises and reconstruction can be very beneficial to helping clients who are there for HIV testing and which can help them through the process of getting HIV tested more frequently, as well as promoting a more positive self-image to those who are tested, as HIV has a negative stigma of someone being promiscuous, or that it affects those of the LGBTQ community. That affects those of the LGBT community only. Um, Cognitive behavioral therapy also goes hand in hand with teaching clients about healthy coping mechanisms on how the test results go. Cognitive behavioral therapy can also help promote clients to being informed about HIV transmission and prevention through its psychoeducation process and can be valuable to improving a person's medication adherence to either HIV prevention medication or those living with HIV to stop the spread of the virus within the community. Key points to cognitive behavioral therapy and HIV prevention within the Latinx community are that it can help pre-testing counseling to reduce the fear of getting HIV tested for the individual, as well as the post-test support for those who might have a positive result to ensure proper education and treatment plan is in place for them about medication and linkage to care, as well as for those who are considering prevention medication and getting them into prevention care. Research questions and hypothesis. A research question that I have in mind would be, to what extent do the social work programs educate or teach HIV and HIV prevention and the Latinx experience? This research questions well the social workers' view of cognitive behavioral therapy and its viewpoints on addressing HIV education and HIV prevention education. Already, however, it will address the key concerns that the Latinx community faces during their HIV testing, segments around HIV, and prevention of medications. The framework around the lack of education and lack of resources for the Latinx community will help address these issues within the social work practices to bring awareness and education within the field of social work to educate social workers in the HIV field on better addressing the key concerns that the Latinx community faces when it comes to those key issues of lack of resources to HIV testing, lack of transportation, immigration status fear, HIV stigma, language barriers, medical insurance for those who are undocumented or don't have insurances. The research questions aligns well with the cognitive behavioral therapy within the social work practices to help address these concerns and issues within the Latinx community to better prepare the social worker to look for the key issues, concerns, and bring awareness to help the Latinx community and reducing stigma around HIV and bring awareness to HIV prevention side to the field of social work field. Some key variables of the study is that key variables that contribute to the research include the dependent variables that will be consist of like such as age, sex, race, ethnicity, language barriers, immigration status, education, and insurance status. The key dependent variable would be the extent to which the social work programs educate about HIV and HIV prevention. These variables help to address the key concerns of the Latinx community on HIV by bringing cognitive behavioral therapy into the social work intervention on addressing the key issues of the lack of HIV education, immigration status, health insurance status, and language barrier that can be a concern for the Latinx community on getting HIV tested, and also bring awareness to the social work field on these key issues to helping address these, creating a better understanding within the social work field of HIV prevention within the Latinx community. Lastly, other variables include the social workers' education level in the Latinx community and HIV prevention. The population that this study would focus is that will be serving the Latinx community as well as the social work field. Key research information on a not on information database on a national level. Over 33% of new HIV cases were Latinx back in 2022. The Latinx community is the second ethnicity behind the African American community with the highest of newly diagnosed HIV cases in the United States. Other key factors to include are the Latinx men are the second highest behind African American men with newly diagnosed HIV cases in the United States. Other things to consider are those who identify as MSM, which is men who have sex with men within the Latinx community, had the highest of new HIV diagnosis cases, and the highest age group was those 25 to 34, and then the highest had the highest between 2018 through 2022, saw a slightly higher within the age groups of 35 to 44 years old as well. The Latinx community is a major component of my research due to the increase of new diagnoses of HIV cases within the last decade, and shows a major concern within the next decade of increases with decade of increase in HIV cases within the United States, as education needs to be a key addressing solution to the problem within the social work field to addressing these key challenges that the Latinx community face when it comes to addressing HIV treatment and HIV prevention medications. Some cultural aspects that could have a major impact on addressing HIV and HIV prevention within the Latinx community can include religious beliefs, as some religions can disregard contraceptives such as condoms as a bad thing. However, this can be an impact when it comes to preventing HIV within the Latinx community. Other key factors can include immigration status of the client, as many Latinx communities can have the fear of getting HIV tested or seeking treatment or prevention due to the fear of disclosing their immigration status to the social worker clinics. Another factor can be the language barrier, as many Latinx are limited to English proficiency, thus making it hard to provide education and resources to the community about HIV testing. However, within the social work field, finding and acknowledging these factors can help address the key concerns and issues within the social work field by creating plans for solution to the problems at hand, such as training social workers with social work programs about these concerns and providing education on addressing the problems on HIV within the Latinx community. Social workers provide education to healthcare providers about HIV and HIV prevention medications, having staff that are trained in translation and training for staff about insurance eligibility services and resources that are out there for the Latinx community. Implications. The research can help with implications that include a multifactorial approach to addressing the key concerns that need to include cognitive behavioral therapy, addressing the stigma around HIV, and help relieve HIV anxiety on HIV testing, along with HIV prevention and its behavioral components. Use prevention methods such as condoms to reduce HIV transmission. Social workers can provide education on prevention treatment, PrEP, which stands for pre-exposure prophylactics, and PEP, stands for post-exposure prophylactics, along with education on HIV treatment options within the Latinx community and how to address these, even if they do not have health insurance. Also addressing the issues of medical staff being trained to help with access to health insurance for those that are not insured for these treatments, and having trained translators on staff to help break the language barriers. And these are my references, and this concludes the end of my PowerPoint.